Good morning. It's a real honor to be asked to talk to you all today, although I admit it comes with a small amount of trepidation. I started attending First Unitarian with my family almost exactly 4 years ago. The timing's really easy to mark as it was directly after the election of Donald Trump in 2016. I've come to feel very much at home in this community, and I've learned so much from being on the listening end of this conversation, and so it's deeply humbling to be asked to share some of my rambling musings. As many of you know, I'm privileged to work as a physician, and I'm doubly blessed to do so here in this place, in this city, province, and country, in a system that at least acknowledges an aspiration towards equality and access to healthcare for all. I'd like to share with you today a bit about my experiences, particularly over the last 4 years, in helping to create and then work in an organization called HamSmart, or the Hamilton Social Medicine Response Team. As I hope you'll see, this organization, which coincidentally was founded around the same time that I started to attend this church, reflects several principles of Unitarianism, particularly the first and second: the inherent worth and dignity of every person, and justice, equity, and compassion in human relations. So as the story goes, about 4 years ago, two naive general internal medicine specialists at the Juravinski Hospital in Hamilton start to notice some disturbing patterns: patients who come into hospital again and again with the same issues, and others who avoid hospital until their situation is so desperate that it's hard to imagine how they managed at home. After lots of thought and debate, they decide that the problem is unequal access to care. We saw that some members of our community could not come for tests and follow-ups because of a very often complicated mix of factors, including mobility issues, poverty, and very commonly competing priorities, such as jobs without sick leave or childcare. Others in our community had suffered real and significant trauma at the hands of the healthcare system, most commonly those with addiction and mental health diagnoses. And so we decided, again very naively, that we could fix it, or at least help, by breaking down some of the barriers that prevent people from accessing the world-class care that exists in our community, by bringing medical expertise, diagnostics, and medications out of the hospital and clinic rooms, into people's homes, and onto the streets. And so HamSmart was born, starting as an outreach service whose stated aim was to provide excellence in clinical care to those who were poorly served by the traditional medical system. I've learned more in these past 4 years than in any similar stretch in my medical career. And there's enough here to keep me talking online long after you all walk away from the computer to enjoy a beautiful and crisp fall afternoon. I've learned a great deal about the strength and resilience of those that are often written off as weak and lazy. I've learned about the incredible trauma and harm that can result when people come to us for help and we dismiss or doubt their concerns. But the lesson I've spent the most time thinking about, particularly recently, is the futility of the traditional tools of my trade, when they're decoupled from an honest reckoning with the systems and policies that conspire to make and to keep my patients unwell. This has come to a bit of a head for me and for the groups that I work with over the past several months, as the coronavirus pandemic has led to a worsening of an already desperate crisis in housing in our community. One very visible manifestation of this crisis has been the proliferation of encampments, both here in Hamilton as well as in many other municipalities across North America. Some of you may know that several organizations that I work with, including HamSmart, were involved in obtaining a court injunction to prevent the city from dismantling encampments, an injunction which is now in the process of being lifted after we reached a negotiated settlement with the city earlier this week. This settlement will allow those who truly have no other place to go to utilize tents on city property, subject to a number of restrictions and regulations. As this controversy was unfolding, I found myself confronted with the human side of what is often a very inhumane discussion around policy. About a month ago now, I was working at a shelter health clinic, and a patient that I've followed for 2 years walked into our appointment with a sleeping bag under his arm. He left that appointment with the sleeping bag as well as a camping mat and a tent. If you follow the rhetoric of several members of Hamilton City Council, what happened in that clinic room makes me part of the problem. Hear me out, and I'll let you decide. I've gotten to know this patient fairly well over the past couple of years. He's had a variety of medical conditions and many, many challenges, including infections, high blood pressure. There's been several broken bones from assaults, and he suffers from ongoing issues with substance use disorder. In the time that I've known him, he's been through and survived a great deal of physical and mental trauma, even just in the last 2 years. And I've often found myself surprised and inspired by his ability to keep going, day after day, one foot in front of the other, in the face of what seems like often insurmountable odds. My goal with him is to try to at least speak to him, but hopefully see him at least once a week. At times over the past 2 years, this has been easier as he's been housed. And at those times, we've made some really important strides towards improving his health, both physical and mental. He struggles to keep a phone, several have been lost or stolen, and so knowing where he's going to be physically and where I can find him has been crucial in maintaining this momentum. There was a good 6-month stretch during this 2 years where I was able to go by his place, stand on the street and yell up at his window, and almost without fail he'd pop his head out hollering, "Come on up, Doc." Unfortunately, these times of relative stability have been the exception. The rising cost of housing in Hamilton has been well documented, as has the long waiting list for city housing. As a single man on Ontario Works, he receives a maximum of $390 per month for shelter allowance. Finding and keeping suitable lodging under these conditions is nearly impossible. More commonly, he's been sleeping outside, finding a place to stay wherever he's able. This has included sleeping in the interior of banking machines. He's slept as well rough on the street and on sidewalks. He's squatted in abandoned houses. He's done just about everything. During these times, his health suffers. It's difficult to continue taking his medications, and it's hard to organize times to meet up and to check in. When I'm able to find him, I watch as his physical and mental health declines, feeling really powerless to intervene. At some point during every appointment, I ask him, "Where are you staying now?" You know, Doc, here and there, wherever I can lay my head. But it gets so hot outside, or it's too cold. And it's hard to just always be outside. I can't hang on to anything, my stuff gets stolen, I can't get a good night's sleep, and I'm constantly on the move. I just want to settle down, I need some rest. What about a shelter, I ask. The shelter just isn't for me. I don't feel safe there. I've tried so many times. I just can't stay there. I'd rather sleep outside. At this point, it's important to state that I have nothing but admiration and gratitude for the work done by the shelter providers and workers here in Hamilton. I work closely with the agencies responsible for Hamilton shelters, and I've seen them move mountains to get my patients off the streets into a place where they can be safe and have a roof over their heads. At the same time, many of my patients choose not or are unable to sleep in shelters, and they always articulate very valid and thoughtful reasons for those decisions. As well, I think it's important for us all to acknowledge and remember that shelters are not housing. They're meant as emergency relief, not as a solution to homelessness. So here we are again. In these situations, I have to force myself to take a step back. My main worry is the patient's blood pressure, or whether he's going to show up for the blood work that I've ordered, whether he's taking his antibiotics for the infection that he has. His main worries are where he's going to sleep tonight. What's he going to eat today? Is he going to be able to find a place to go to the washroom when he needs to? Is he going to be able to take a shower? Most of the time, I really don't have much to offer that can address his very legitimate concerns. I write out my prescriptions. He very graciously agrees to come and see me again in a week or two, going out of his way each and every time to thank me for the little I'm able to do. On this occasion, I added a tent to my prescription. Do I think in doing so I solved any of the monumental challenges he faces day to day? Of course not. But for now, at least I know he has a shelter, a place to keep his things, and that he's staying where others can be around him and can look out for him. In fact, over the last month or so since that appointment, I've been able to see him weekly. And just last week, he was able to secure a place in a city-run hotel. He hopes to use that as a springboard to more stable housing. So for now, I know where he is. If he doesn't come back for his appointment this week, I'll know where to look and where to find him. I still worry about him every single day. I hope this is a first step toward finding more permanent housing, but I'm realistic, and I know that there's likely to be some more ups and downs on the road ahead. So what is the most important lesson I've learned during my 4 years of doing this work? the lesson this patient and many others have taught me? It's silly for me to think that my medicines or ultrasounds or blood tests are going to have any appreciable benefit for people who don't have a place to lay their head at night. This is why the work that's being done by those in the Social Justice Committee around housing is so important. This is why a tent is better than a sidewalk, and a hotel room is better than a tent. But best of all is permanent housing that meets the needs of the individual, and which is unconditional upon factors that are often outside of an individual's control as possible. This is an achievable goal. The COVID pandemic has made the realities of homelessness in our community worse for certain, but what it has really done is made these realities more visible. There are many in our community who would prefer that we get back to this magical normal that people keep talking about, but I'm here to tell you that normal doesn't mean that the tents are gone. There have always been people sleeping rough. There have always been people camping. In previous years, because they had to, the majority of these tents would be off in the woods where they weren't seen. I've had patients die in these tents, alone, away from services, away from me. I don't want to go back to that normal. Sure, that might mean that the tents are gone from the sidewalk, but what it really means is that it's easier for us all to look away. I'm glad to be part of a community that's committed to not looking away. I encourage you all to commit to redoubling those efforts. I gave my patient a tent. Some say that makes me the bad guy. What would you have done?